Hi, I'm Neil O'Grady. I'm an osteopath and I'd like to explain to you how to test the cutaneous nerve supply to the lower limb. It's tested in different ways, usually just using a piece of cotton wool with a little pointed piece like that, just for basic sensory testing. And then what you can also do, because it senses the nerves, cutaneous nerves can be affected in different ways, you'll also test it with vibration. So you can use a tuning fork here like that on the various spots, or you can use hot or cold or proprioception. For example, I just close your eyes there for a second, I'll move the toe into position, you tell me if it's up or down.
Down. Up.
So to see if he knows where his limb is in space and time, and you can do that throughout the low limb. So basically, where do the nerves in the low back feed in the leg in terms of cutaneous nerve supply? So the dermatomes, we call them, the areas of skin fed by the various nerves, will go like this. L1 up around the pocket, L2 here, L3 a bit lower down here like that. L4 will come down the side of the leg across the knee and into the low leg. So we'll use this area here in the medial aspect for L4. L5, the lateral aspect where the perineal muscles are, along the dorsum of the foot and up here to the kind of great toe. And if we want to test S1, usually we'll use the outside of the foot where the fifth digit is, along the lateral aspect of the foot or the sole of the foot here like that. Okay, so what we'll do is, in order to test it and so that he doesn't anticipate where I'm going to go, I just get him to close his eyes, and when I touch you with this piece of tissue, it'll feel like that. Feel that?
Yes.
Okay, so just say yes when I'm on a certain area. So
yes. 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 Yes.
okay, so that's how you would do sensory testing for the low limb. And he may have lack of sensation in one side, which would indicate perhaps a bulging disc or nerve root impingement or some kind of that's causing some kind of sensory loss, paresthesia, numbness, pins and needles to the low leg. So that, everyone, is a sensory test for the low limb. If you liked the video, please subscribe. Talk to you next time. Thanks.